In this video, we'll discuss about Petra. It is a Spanish term meaning stone because nodules are hard. It is also a superficial mycosis, superficial infection of hair shaft and forms. That Petra characterized by development of irregular nodules in the hair shaft. It is a fungal element or cemented together to nodules. The fungal element together to form nodules. Maximum this one is asymptomatic. It affects both genders. Then types based on the causing agent and the characteristic of nodules. There are classified into two main types: white Petra and black Petra. White Petra and black Petra. First, we want to discuss about white Petra, first described by Beigel in the year of 1865. This one causing infection in hair shaft, characterized by soft grayish white irregular nodules. This one will form grayish white irregular nodules. Causing agent is like fungus, name is called as Trichosporon beigeli. Trichosporon beigeli is the causing agent of white Petra. This white Petra is also called as Beig's disease, Chicknen disease, and Tinea falanca. Tinea falanca. So, white Petra, it causes infection in hair shaft, characterized by soft grayish white nodules. Then causing agent Trichosporon beigeli. Other names Beigeli disease, then Chicknen disease, then Tinea falanca. So, infection caused by Trichosporon species. Here, white Petra in our skulls and also body part, mainly pubic region, it causing disease. In head, it have that name, causing agent name Trichosporon ovoides. Trichosporon ovoides, and pubic region Trichosporon inkin. So here this white Petra in our scalp head part, causing agent Trichosporon ovoides. In pubic region Trichosporon inkins. These are the diseases caused by Trichosporon species. Epidemiology of white Petra. It is seen in soil, occasionally seen in normal flora. Then it affected humans as well as animals, mainly horse. Then ethnic basic has been seen. It is found in Muslim girls wearing hijab. So, ethnic basic has been found in Muslim girls wearing hijab. Widely distributed in tropical and temperate region. This one mainly affected in young women. Then age and sex incidents vary from country to country. Then depending upon their hairdressing, fashions and social customs. Then extract factors or sources are unknown. Then swimming and bathing in stagnant water causes this white Petra. Then sexual transmission and humidity are predisposing factors. So extract sources unknown, swimming, bathing in that stagnant water and sexual and humidity are predisposing factors. Pathogenesis of white Piedra characterized by soft nodules. It having soft nodules, white to light brown in color, hair is weakened and break easily. Nodules are formed in the form of a sheath. It consists of mycelia and arthrospores. So these are the pathogenesis. Soft and nodules, light brown to light brown in color, white to light brown in color, hair weakened, break easily, consists of mycelia and arthrospores. Then clinical features: nodules are seen on distal portion of facial, axillary hair, beard, mustache and pubic hairs. Then less common in scalp, eyelashes and eyebrows. Sometimes pleuritis seen accompanied by inflammation of skin fold. Sometimes pleuritis can also seen. Then hair breaks at the point of infection, leaving the end swollen. Next, laboratory diagnosis of white Piedra, that nodules are visible to naked eyes. They do not fluoresce on wood lamp. On direct microscopic examination of hair nodules with hyphae rectangular arthrospores can be seen. In direct microscopic examination, in that hair nodules, we can see with hyphae rectangular arthrospores can be seen. Then plastogonedia are also formed. Hyphae rectangular arthrospores along with plastogonedia are formed. Stains like chlorosol black E or Parker blue black. Stains are chlorosol black E or Barker blue black. In ink may be added to enhance the visibility of fungal structure. For more visibility, we are adding ink, chlorosol black E or Barker blue black. Then fungal culture is done on saffrose dextrose agar medium at 37 degrees Celsius with chloramphenicol. Then moist yeast like creamy colored soft or folded radiating colonies are formed. It containing hyphae, plastospores and arthrospores can be seen after 2 to 3 days of incubation. Young culture is whitish pasty in consistency. So fungal culture we are using SDA, saffrose dextrose agar medium, along with the chloramphenicol. Then moist yeast like creamy colored soft and folded radiating colonies are formed. These colonies containing hyphae, plastospore, arthrospores. After 2 to 3 days incubation, young culture is whitish pasty in consistency. As aged culture develop deep radiating furrows and yellowish color with creamy texture. Old culture develop deep radiating furrows and yellowish color with creamy texture. Then lactophenol cotton blue mount reveals septate hyphae rapidly fragmenting to form rectangular arthrospores. Physiological studies are essential to establish species identification of genus Trichosporan. Lactophenol cotton blue septate hyphae are formed to form rectangular arthrospores. Then physiological studies are essential to identification of Trichosporan. Then this Trichosporan bacilli does not ferment carbohydrate. Trichosporan vagili does not ferment carbohydrate. They can assimilate glucose, sucrose, galactose, maltose, and lactose. It break down urea and uh, this DBB positive, disolium blue B positive. Above features help to identify these Trichosporan vagili from other species. Slide agglutination test can also used to identify trichophyton. So these are the tests we are using, STA, then lactophenol cotton blue, then physiological studies, then it cannot ferment carbohydrate, assimilate with glucose, sucrose, galactose, lactose, break down urea and DPP, disolium blue B, then slide agglutination test also used for identification of trichophyton. So, black Piedra, nodular type of infection of the hair shaft, then causing agent Piedra carte, then it causing disease name is called as Tinea nodosa. Then Malkai horse described black Piedra for the first time in 1901. So, morphology part of black Piedra, nodular type of infection in hair shaft, then causing agent Piedra carte, then disease is also known as Tinea nodosa. Then Malkaigos described black Piedra for the first time in 1901. Then epidemiology, this one found in tropical countries in warm and humid climate. Then this organism exist in soil. It can affect human monkeys, more common in males as comparing to females. Then pathogenesis, infection start under that cuticle of hair shaft. Then formation of stony, hard and black nodules. Then fungal mass enlarge, grow outside of the hair, completely envelop that shaft. Black encrustation vary in size from microscopic to 1 to 2 mm. Fungus destroyed the cuticular layer of hair, penetrate deep into the cortex. Destruction of hair shaft and loss of hair is a result. Branched hyphae and ascospores can be seen. Branched hyphae and ascospore can be seen. Clinical feature characteristic by formation of hard brown black nodules. Here hard brown black nodules formation 1 mm diameter attached to hair shaft, mainly seen in scalp hair. Nodules are gritty to feel. Then a metallic sound may be heard when the hair is combed. Then itching is absent. Brown black nodules 1 mm diameter, mainly seen in scalp hair. Nodules are gritty to feel. Metallic sound when we are homing that time. Then itching is absent. These are the clinical features of black Piedra. Then the disease may last for month or year if untreated. Medical advice taken only for cosmetic reason. Then mode of spread not defined. Then contagious disease outbreak can be seen in ladies hostels. Then mode of transmission, sharing combs, pillows and bedsheet. Next, laboratory diagnosis, microscopic examination of crusted nodules. So microscopic examination of crushed nodules in 20% of KOH or CFW wet mount. Then dark colored thick walled septate hyphae around the hair shaft. Dark color thick walled septate hyphae around the hair surface. Then septation seen which gives the appearance of arthrospores. Then a round to ovate ascus with 2 to 8 curved. Banana shaped ascospore with whip-like appendages. Hair samples is inoculated on saprostextos agar medium with chlorophenicol or glycine or acetidone. Culture shows slow growing coat plaque colonies. Ascospore production can be enhanced by diluting saprostextos agar with or without biotin. Lactophenol cotton blue shows dark walled septate hyphae with chlamydiospore and ascus. Microculture technique may also be employed using dermatophytes test medium. So here lactophenol cotton blue shows dark walled septate hyphae. Microculture technique may also be employed. Then treatment and prophylaxis of black petra. Ideal treatment of both petra, that means black and white, is shaving of hair of affected area. American Academy of Dermatology guidelines or outcome committee recommended the complete removal of hair. Affected means complete removal of hair is the solution. Hair shavings of scalp is effective in men. Then applications of topical agent mainly azole derivatives such as cotrimazole, ketoconazole on the affected hair cures the infection. So treatment purpose we are using cotrimazole, ketoconazole. Then white petra treatment imidazole, selenium sulfide, amphotericin B lotion used. Oral azole medication for 3 to 4 weeks is combination with shampoo for 3 to 4 months appear effective without the need of savings. Then Terbinafine 250 mg daily for the period of 6 weeks is effective for black petra. Good personal hygiene should be practiced to avoid infection with both type of petra. So these are the treatment. Good personal hygiene should be practiced to avoid infection with both type of petra. Thanks for watching.